This is another case, my friends, another case of a child age about 9 years. কত বয়স? 9 না 90? 90 না, তো 90 নয়, 9 বলছে বাচ্চা। So a case of psoriasis, skin disease, এক জায়গায় দেখি পায় এরকম psoriasis ছড়িয়ে পড়ছে চারিদিকে। ওর বাবা মা তো খুবই অ্যানয়েড, খুব উদ্বিগ্ন হওয়াটা স্বাভাবিক, একমাত্র সন্তান, এবং অনেক চিকিৎসা করছে কিন্তু আরোগ্য হচ্ছে না। ছোট ফুটফুটে সুন্দর বাচ্চা, বুদ্ধিমান বাচ্চা, ভালো বাচ্চা যদি এরকম একটা রোগে ভোগে, তা বাবা মায়ের তো দুশ্চিন্তা হয়। বিশেষ করে বাবা অত্যন্ত দুশ্চিন্তার মধ্যে আছে, আমি এটা বুঝলাম। তো এই বাচ্চাকে আমি সম্পূর্ণ সুস্থ করে দেবো, এটা আমার কাছে আরেকটা নতুন চ্যালেঞ্জ। I have accepted the challenge once again to curing the psoriasis, which is apparently said in the practice of medicine that the disease is incurable, but already I have cured many cases and I have given the videos in my YouTube channel. Psoriasis, কি নাম রোগটার? রোগটার নাম কি? রোগের নাম জোরে বলো। psoriasis, কি মিষ্টি নাম বলতো। So psoriasis, I have repeatedly told about the disease. The psoriasis is a skin disease, well-defined erythematous scaly plaques, and by nature they are the chronic inflammatory hyperproliferative skin disease. They are the results of formation of immature epidermal cells which are shaded as scales. It can appear at any age, but commonly under the age of 5 years. Many times it is in relation with the family history, so may be considered as genetic. But not only genetic, there are also some environmental factors are responsible for this disease. সব মন দিয়ে শুনবে, তোমাকে আমি জিজ্ঞাসা করবো, তুমি ইন্টেলিজেন্ট ছেলে, তোমাকে সব বলতে হবে যে আমি কী বললাম। Generally, in many cases, no itching. However, some patients may have developed itching. The lesions worsen during winter and improve or even clear in summer. So there is a following of emission and remission of these diseases. I have told about the symptomatology, the cause, about the prognosis and management of the case in many of my videos. Now, what will be the prescription of this child? See, this child was treated by allopathically. Naturally, many allopathic physicians, they have consulted. This is on Dr. Gautam Banerjee, one of the renowned dermatologists. He treated for a long time. And they have treated according to their own method. I have nothing to say about that method, which I have little knowledge about the modern medical science. The child was once again without any improvement from Dr. Gautam Banerjee. The child was treated by Dr. H.N. Chatterjee, another dermatologist, MD dermatologist. And the father of the child given much time for every physician. Without being the good result of the Dr. Chatterjee, they have consulted another dermatologist, Dr. H. Bandyopadhyay. And he had seen the child for a long time, and there are many prescriptions of Dr. H. and Chatterjee. Being frustrated from the allopathic mode of treatment, from the renowned specialist, he consulted on a child specialist near to his residence, Dr. Arun Kumar Pal. He has treated accordingly for few months, but without any improvement. This physician, Dr. Pal, was a broad-minded, and he advised that it is not curable in allopathy, rather you can consult a homeopathic physician. ঠিক বলছি? ডক্টর অরুণ কুমার পাল একজন হোমিওপ্যাথি ডাক্তার দেখাতে বললেন। ওনারা ওনাদের বাড়ির পাশে, they are belongs to Hooghly at Singur, the disputed Singur. And they consulted on homeopathic physician named Dr. A.K. Das, who passed from J&J Homeopathic Medical College and Hospital. And in his prescription, it has been written, he is a chronic diseases specialist. The parents given 1 year time to this physician, Dr. Arun Kumar, Dr. A.K. Das, but without any good result. Lastly, again they are frustrated and clearly told to the physician, we have given enough time to you, but my child has not improved a little bit. What are the medicines you have given? Please give me the prescriptions. I shall consult another homeopathic physician. The doctor written the prescription. We have seen that he had given graphitis on him, X-ray on him, mark sol, tarantula hispania, probably petroleum, basilinum tenem. He had prescribed, he had treated according to his own knowledge and tact and talent. Now the patient has come to me. What will be my prescription? See, within the prescriptions and selections of Dr. Das, no phosphorus. My selection is phosphorus. The previous physician, my friend, prescribed medicines belongs to skin diseases. Graphitis is a medicine for skin disease. X-ray, where there is lot of suppression. He thought many allopathic physicians treated, so better to prescribe a few doses of X-ray. He prescribed mercurius, petroleum, basilinum, considering the skin disease psoriasis. But my friend he had forgotten that the theory of homeopathy is treat the patient, not the disease. And many of the homeopathic fails. Many of the homeopath fails. Many homeopathic failures are due to changing or overlapping the dictum, not treat the patient, but treat the diseases. He has prescribed, he had thought about the skin disease, but not the man, not the child. But on my observation and asking from the parents, what I have observed, the child is intelligent. Buddhiman khub, restlessness to the infinity. Khub chhatpote. So restlessness, intelligent, fear of alone, একা থাকতে ভয় পায়, অন্ধকারে একা থাকতে চায় না, খুব বেশি ইম্পর্টেন্ট না হলেও মোটামুটি আছে। And he has tremendous desire for cold foods and cold drinks and ice cream. বাচ্চা আইসক্রিম ভালোবাসো খুব, কালকে কটা খেয়েছো? কালকে 3টে খেয়েছে, বেশি খাইনি, 3টে, ডাক্তারের জন্য একটা আনলে না। So tremendous desire for cold drinks and ice cream. চোখ মুখ কথা বলছে, eyes are brilliant, আমাদের একটা রুব্রিক আছে, eyes are brilliant, অত্যন্ত মেধাবী, অত্যন্ত বুদ্ধিমান, অত্যন্ত চৌখস ছেলে। So these are the symptoms of phosphorus. These are the symptoms of phosphorus. Desire for cold drinks and ice cream, fear of darkness, inquisitive, যে কোনো ব্যাপারে প্রশ্ন করে, জানতে চাই, শিখতে চাই, বুঝতে চাই, অনুসন্ধিৎসু মাইন্ড। See, if you see the first line of the hearing guiding symptoms, phosphorus mind, mind is overactive, mind is overactive, great flow of thoughts, হাজার চিন্তা, হাজার জিজ্ঞাসা, great flow of thoughts, difficult to arrange, difficult to arrange, কোনটা বলবে বুঝতে পারে না, বাবা মা কোনটা উত্তর দেবে, এত জানতে চায়, এত শিখতে চায়, এত বুঝতে চায়, এত জ্ঞানের ভান্ডার সম্বন্ধে অবহিত হতে চায়, is the symptom of phosphorus. So intelligent, fearlessness, restlessness, inquisitive, desire for cold drinks and cold drinks, catches cold very easily, also phosphorus, and aversion to sweets, মিষ্টি খুব একটা পছন্দ করে না, মিষ্টি খাবার দাবার যারা খায় সামনে সেখান থেকে উঠে পড়লে বাঁচে, এইটা দেখেছেন আপনারা, বলেছেন আমাকে। So aversion to sweets, so aversion to sweets, fear of alone, aversion to crowd, কোথাও ভিড়ভাট্টার মধ্যে জিনিসপত্র কিনতে গেলে, মেলায় গেলে, দোকানে গেলে, বাজারে গেলে ওর প্রয়োজনীয় জিনিসটা কিনেই চলে আসতে চায়, এটা বলেছেন। সো একা থাকতে যেমন ভয়, ফসফরাস কোম্পানি খুব একটা পছন্দ করে না। সো মাই রেপার্টরি, the repertory which is going to be published, there is a rubric, fear alone when phosphorus, alone when একা থাকতে খুব একটা চাই না phosphorus. So crowd aggravates, ভিড়ভাট্টা খুব একটা পছন্দ করে না। crowds, society, etc. aversion, ailments, phosphorus. So all symptoms correspond to phosphorus and the child require phosphorus. Considering the restlessness, all the mental symptoms, restlessness, fear of crowd, fear of alone, these are for cold foods, cold drinks, inquisitive, aversion to sweets, and constipation also is a symptom of phosphorus. Irregular stool, the child passes stool irregularly, rose paikhana kore na. So constipation is also a symptom of phosphorus. So catches cold very easily, aversion to sweets, these are for cold foods, cold drinks and ice cream are the physical generals, and mental generals are full of phosphorus, intelligent, inquisitive, fear of crowds, fear of alone, restlessness. So phosphorus is the choice of medicine, and I do like to prescribe phosphorus, which is not at all important or so-called given in the therapeutics, a medicine for psoriasis. So treat the patient, not the disease or dictum, is our principle. Maybe it's psoriasis, maybe it is skin disease, maybe it's brain cancer, tumor, ulcer, fistula, or any other disease. The symptomatology of the patient, including mental and physical, by rational thinking of physician's judicial mind, ecumenic thoughts, the prescription should be, and that will be the art of prescribing. And this is possible only by proper case taking, by considering the points, present complaints, past history, family history, personal history, general symptoms, and applying the physician's own tact and talent, his observations, which together I have collected and given to my followers, instructed to my followers to follow in every cases in their clinics, known as Dr. Rubin Burman's mode of or method of treatment. So this is a challenging case to me, and I do believe the child will be improved by phosphorus alone, which was not given by our previous homeopathic physicians, whose insight eye was very narrow toward the disease and not to the patient. Though for 4 and 5 years he has studied, treat the patient, not the disease theory, and written in the prescription, treatment is done for only chronic and complicated diseases. He does not know anything about the principle of homeopathy.